Supreme Court recently ruled on health care, but some in Congress continue to debate the Affordable Care Act. Hello everyone and welcome to Comcast Newsmakers. I'm Robert Trenum. We're here on location in the U.S. Capitol, and I'm joined by Congresswoman Rosa Delauro, Democrat from Connecticut. Congresswoman, welcome to the program.
Thank you so much.
So why are your Republican colleagues continuing to press the issue that the Affordable Health Care Act needs to be repealed when all three branches of the government, the executive branch, your branch, and now the Supreme Court have ruled on this issue?
Well, that's precisely the point. It doesn't really make sense to do this, but to move forward, to strengthen the law, to implement it, and to make it better for people. The core principle of the health care law is to make sure that people have affordable health care coverage for those who have insurance and for those who do not have insurance. In place already. The insurance companies can no longer discriminate against women, charging them 48% more for their health care. They can no longer say no to health care coverage for women if they have been a victim of domestic violence, or if they've had a child by cesarean section. And the insurance companies now must pay 80% of your premium dollar on health care needs and not on administrative costs. In addition, children up to age of 26 can be on their parents' health care plan. Seniors who are in that donut hole can now get a 50% rebate on brand name drugs. And about 114,000 seniors in Connecticut have taken advantage of the free wellness and preventive care, cancer screenings, mammography, and a whole variety of other preventive care efforts.
So, Congresswoman, the Republicans, they obviously have read the bill. They know all the popular provisions in the bill. But you have Mitch McConnell, you have Speaker Boehner, you have others who are saying, on day one of a Romney administration, we would repeal this act. Why? Why are they doing this?
It makes no sense to do this because even by virtue of the Congressional Budget Office, this health care law will reduce the deficit. That's not my terminology, but what the Congressional Budget Office says. So a case that they would make saying that they're going to reduce the deficit, it is not the case. Businesses benefit, children benefit, families benefit. The law needs to be implemented. We need to move on, strengthen it, and make sure people in this nation have health care coverage that they can afford.
Congresswoman, we should mention the Congressional Budget Office is a nonpartisan or bipartisan
That's right.
Organization that recently ruled on the Supreme Court in terms of the Supreme Court ruling in terms of the Medicaid provision. That's correct?
That's right.
I want to move on, talking about health care, but move on to a slightly different topic. Why do you think the Republicans continue to say that this is going to have big government in the examining room? That this is going to have, the government is going to be making healthcare decisions. Can you understand their point of view and their logic when they say that?
I can't be in this context because this is really, when you have the exchanges, people will be able to, it's a marketplace. That is private insurance. What's going to happen is for individuals is that you are going to be able to get a menu, a choice of what plan to select according to your health care needs. Today, most people may not have that choice. And I might add that members of Congress are going, and their staffs will get their health care coverage through these exchanges. So it is a private system, and yes, there is some criteria that the federal government has placed on insurance companies so they can no longer just willy-nilly even bankrupt people who have high medical costs.
Congresswoman, we have about 20 seconds left. Very quickly, the viewers out there that are listening to this program, very quickly, what should they know about this bill?
What they should know is that it has benefits for themselves and their families, and we need to implement it.
Thank you, and of course, thank you for joining us for this edition of Comcast Newsmakers. I'm Robert Trenum.